We're just a few weeks away now from the start of the healthcare exchange, which is part of the president's affordable health care law.
Now, that means if you don't have health care insurance, you could face penalties. As reporter Paula Toti shows us tonight, that's causing a lot of confusion for small business owners.
McHale's Events and Catering is a family business. Chuck McHale is third generation, and he's proud of the health benefits offered to full-time employees. But he's wondering what the Affordable Care Act will mean to his bottom line.
Just so many unknowns until we get to October 1st and the exchange comes out and we start seeing rates, and we'll be a little more educated on where we want to go.
To make matters more confusing, the employer mandate to provide health insurance with 50 or more full-time workers was delayed a year. Yet individuals without health insurance will pay a penalty beginning in January. The individual mandate was not delayed.
Uncertainty was probably the best way to describe how I feel right now.
Jack Nye says that as an employee at a company with 22 workers offered health insurance. He understands what the president of K4 Architecture and Design is facing.
And our concern is that it may get to a point where it's hard for us to compete with the benefits in the exchanges.
In other words, the health plans now offered employees might cost more than what individuals can buy on their own in an exchange. So does he then offer money to employees so they can buy their own coverage? And something I didn't mention about McHale's, they don't always have 50 workers. They have a lot of seasonal workers. Going forward, Obamacare is a consideration.
It looks like it's easier. We stay under the 50. We don't fall into all the regulations, and we don't want to not grow, but we're keeping a close eye on it.
Uncertainty around health care certainly surpassed economic uncertainty, and certainty about the economy as being one of the number one issue for employers.
The Chamber of Commerce perspective is the Affordable Care Act isn't good for an economy that's recovering but struggling.
And just to reinforce how confused small businesses are, the U.S. Chamber found 30% of small businesses are ready for the Affordable Care Act. 44% say they are not, and 26% say they don't even know what's required.
Uncertainty in our mind and anybody's mind when you're trying to plan your business doesn't bode well for moving ahead.
John Venturella was among a handful of CPAs invited to Washington to talk to the assistant treasurer for tax policy. He told him companies across the country are pausing with their 3 to 5 year strategies.
Because they don't really understand or know how this new law is going to impact their business and hence their bottom line.
Venturella was told companies should treat the next year as a practice year and choose the benefits they need to keep a competitive workforce. That's why the companies we met do offer benefits.
We take a lot of pride in our compensation packages.
And they're not saying they're against the coming changes.
See how it plays out. It's just so confusing.
And concern at McHale's with a young pool of workers, they could see rates jump 20 to 30% as insurers accept more older workers who are less healthy. In Cincinnati, Paula Toti reporting.